Lots of folks. Get you right here, Justin. Mr. Shanto right over here.
Oh, okay.
Shorts right over here. Okay. Right here. In-person media, this is great.
Yeah, it's good to see you all again. It's been so long.
Well, I go first. I can go up there, right?
So, okay. Welcome, everyone. Thank you for coming to our announcement. We'll start with Minister Shandro, and we'll move through our speaking list.
Well, thank you, everyone, and thank you so much for joining us here this afternoon. Pleased today to announce a new Made-in-Calgary partnership that will help protect both health care workers in the province as well as the public from COVID-19. Now, before the pandemic, Alberta Health Services used about 33,000 medical-grade masks per day. Since the pandemic has arrived in Alberta, that number has skyrocketed to about 600,000 per day. And earlier this year, as the pandemic swept across the globe, many jurisdictions struggled to be able to find the masks and other protective equipment that they needed to be able to protect the public and their healthcare workers. I'm proud to say that Alberta was not among them. In January, AHS began acquiring equipment and supplies and used their buying power as a single health system throughout the province to ensure a continued supply of medical masks, as well as other materials that they needed throughout the pandemic. Now, this was an Alberta success story. It ensured that PPE was readily available for healthcare workers and others as well when they needed the most. AHS, quite frankly, did stellar work, procuring the supplies that they needed from around the world. The only way we could do even better would be to make our own personal protective equipment right here in Alberta. So guess what? We're going to do just that right here in Calgary. And in April, our government launched the Alberta Bits and Pieces program to provide a way for businesses and citizens to offer products as well as services to help others during an emergency. One of the companies that answered the call was Orpix Medical Technologies, where we are here today. Now, under a $60 million contract with AHS, they'll supply medical masks over the next 2 years, more than 40 million of them in total. That's about a tenth of all the masks that AHS needs at the current rate that they're using them. These masks will help protect healthcare workers, patients, and visitors across the province. And by the way, right behind us, you can see 2 million of those masks right now behind us, ready to be shipped. And I understand that there'll be 1 million per week to be shipped. So fantastic work that Orpix has done already to date. Now, to ensure the safety of staff and patients, the masks have undergone rigorous testing to ensure that they meet Alberta's high standards. They'll supplement AHS's existing supply coming from other vendors across the world. And along with benefiting our health system, this Made-in-Alberta solution also shows how innovation in companies like Orpix contributes to our province. So I want to thank very much Dr. Brianne Everett and Orpix, her entire team at Orpix, for taking on this role and for their innovation, for their flexibility, for their foresight, for stepping up and answering the call, as I said. COVID remains a very real threat in our province as well as our country, but we continue here in Alberta to rise to the challenge. Agreements like this one with Orpix, between Orpix and AHS, show that we are committed here in Alberta to strengthening our health system and taking whatever steps are needed to protect Albertans in the days ahead. So thank you very much for joining us for this announcement. I'd like now to ask Minister Doug Schweitzer to be able to come up and step up and speak on behalf as well of the Alberta government.
Thank you, everybody, for being here today, and thank you, Minister Shandro, for inviting me to be a part of this announcement. And I must say, wearing one of these masks, I've worn a few masks in the last couple months, as many of us have. I see a Flames mask over there. That's a high-quality mask that's being made here in the province of Alberta. Many of us wouldn't have thought about this as even a business opportunity in this province until we got into this pandemic. And here we have an Alberta-based company that has taken the bull by the horns, taken the opportunity here, and is now developing these high-quality masks right here in the province of Alberta. That's innovation. That's entrepreneurship. That's the drive that we're looking for in this province. That's the story Alberta has to tell. And it's really that foresight of Alberta Health Services and our Minister of Health and a lot of their efforts in making sure that we are prepared for this pandemic. And now as we move forward, there's so many different elements of society that have gone back to kind of semi-normal. We still have to act so responsibly in our day-to-day lives, but initiatives like this are so important for us to have stable supply chains, continue to be a leader in the country when it comes to innovating, looking at different opportunities, finding out how we here in Alberta can be at the forefront in taking care of each other, making sure we have those right opportunities. So it's truly a credit to the team here for what they've built and what they've developed here for our province. We also have many other examples of innovation happening exactly in this space in our province. A couple of weeks ago, we had an announcement at a company that provided mainly oil field services just a few months ago. But now, through this pandemic, they were able to develop ventilators, design, approval, and actual production of ventilators that were provided to Alberta Health Services. So it's really a credit to Albertans. This is a huge opportunity for us as well to continue to innovate and grow. It's a real immense opportunity for us and a real credit to the team here for what they have done. And just look at this, 2 million masks. Just a historic day for us here in Alberta to be able to do this. Just like we've broken records for the number of doctors that we have in this province, a true credit to our health minister and the team there, getting the most doctors on record ever in our history with over 11,000 doctors here in the province of Alberta, plus this mask milestone as well. Huge credit to the team at Health. Thank you so much for everything you're doing to keeping us safe in society. And in my new job with jobs, economy, and innovation, the biggest thing we can do is to continue to make sure we follow the health protocols, make sure we continue to social distance, wear our masks, wash our hands. Those little things will keep our small businesses and our mid-sized businesses open here in the province and allow us to continue to operate. So thank you to everybody, and I just appreciate being a part of this announcement.
Hi. So I want to say thank you for the opportunity to speak today. My name is Dr. Brianne Everett. I'm the CEO of Orpix Medical Technologies. We're very, very excited to announce this partnership today, and I really want to underscore that this partnership has only been made possible by the tremendous, unyielding work of many individuals and companies. There's been a strong collaboration over the course of this between Orpix Medical Technologies and our manufacturing partner, Fidelity Medical Manufacturing. And in addition to that, 2 other Alberta companies have really stepped up to the plate in order to make this effort come together so quickly. And that includes Edon Management and Engineered Air. The rapid engagement in our proposal from Alberta Health Services allowed us to really marry expertise and skills of these 4 Alberta-based companies very quickly, rapidly, hit the ground running with a Made-in-Alberta solution, and do so on Calgary soil here. So in this extremely difficult and very different year, it's really this level of industry collaboration and industry-government collaboration that has allowed us to basically produce this growing group of Albertans that have been able to contribute in a very meaningful way towards addressing and ultimately defeating this global pandemic.
And Nick Thane as well, who is the commander of the Zone Emergency Operations Center with AHS for Calgary Zone. So Nick, if you don't mind speaking on behalf of AHS.
Thank you, Sandro. Thank you, Minister. Thank you very much, Dr. Everett. It is a pleasure to be here today and be part of this announcement. In order to be able to take the tour and see the masks that are going to be provided to the staff, physicians, and volunteers and patients and families inside our facilities is absolutely incredible. And knowing that we're able to share that through an Alberta initiative is great. I'd like to thank Dr. Everett and her team here at Orpix for taking on this initiative. It is absolutely fabulous. Ensuring that we have appropriate PPE continually to our staff, physicians, patients, guests at our healthcare facilities is absolutely critical, as Minister Shandro pointed out, in order to be able to continue to flatten the curve. These masks play an important role in keeping everyone safe during COVID-19 pandemic, especially in our public spaces. All staff, physicians, volunteers are required to wear masks in all patient areas and public spaces at all times. We also require patients and visitors to be masked in our facilities. But it's not just at our sites. The COVID-19 pandemic is unique in that AHS is now the sole provider of PPE to many other groups, system partners, and organizations across this province. To have masks made right here in Alberta, in addition to the overseas supplies, will go a long way in ensuring that AHS has the long-term, continued source of personal protective equipment that we require. The quality of these masks is also important to mention. The Orpex mask has been made right here, but has also been independently tested in a lab to ensure they meet the international clinical standards. Above that, we've also involved staff in the testing of these masks, and as part of that review, to ensure that the AHS Quality Assurance Group, comprised of those frontline workers, have approved these masks. So on behalf of Alberta Health Services, I can say that our organization is extremely pleased that we are here and able to help make this announcement today. Thank you to the Government of Alberta, whose vision and efforts and the Bits and Pieces program, which sought Alberta organizations and companies to develop and provide goods and services to support the province's response to the COVID-19 pandemic, has helped greatly. So on behalf of AHS, thank you very much for the opportunity to speak here today. Thank you.
And just before we take questions, just because we have Nick here, as I mentioned, Nick is the commander of the, the Zone Emergency Operations Center, or ZEOC for Calgary Zone. We have a different ZEOC for each of the 5 zones throughout the province. So Nick, to you and to all your staff in the Calgary ZEOC, as well as anybody who's listening to this, who's been working in any of the 5 ZEOCs, thank you to all of you for working around the clock to protect Albertans and to respond to the pandemic. So Nick, thank you to you and your staff. Happy to take questions, Justin.
All right, so we'll start, see if there are any questions here on the floor, and then we'll go to the phone queue. Is there anyone who'd like to ask a question here? Go ahead.
For whoever's best obviously suited to answer this, when it comes on a mask per mask basis, how cost effective is it to manufacture here in Alberta as opposed to the current procurement process, and what economic benefits will we see?
Well, Nick, do you...
It would be JP and our CPS.
Yeah, we may have to actually get you to talk to Mr. Jithran, or sorry, Mr. Prasad, Jithran Prasad, who's the Director of Procurement for AHS, to break that down. I mean, the reason that the most personal protective equipment, as well as most procurement that's required for AHS is procured throughout the world, is because they are trying to get the best price. Most of our response to the pandemic, Mr. Prasad was procuring mostly from outside of Canada. So there is some benefits to that on a cost basis, but the exact numbers, we'll get you in touch with Mr. Prasad so he can answer that question for you. Do you have a follow-up?
And follow-up,
Yeah.
Your comments on the editorial today calling for you to step down?
Well, look, I think the board members of the editorial board of the Edmonton Journal, the way I read it, they're basing it on misinformation. Look, maybe let's talk about one part of misinformation I think that they were relying on, and it's the disinformation of the NDP. I think, look, if today is actually a perfect day to point this out, because today, these aren't numbers from me. These aren't numbers from the ministry. These are numbers from the independent regulator of physicians, the College of Physicians and Surgeons, who are coming out today with their quarterly report on the number of physicians that we have in the province. This unfortunate falsehood that we have physicians who are fleeing the province is again being shown to be untrue. Now, I keep on being asked about that. I keep on saying it at podiums like this. It's not getting reported, and I get it. You know, I'm not personally attacking someone. I'm not lying, so it's not going to get clicks. But I keep on pointing out that the independent numbers of the College of Physicians and Surgeons is showing that we have, on a month-to-month basis, except for because of COVID in April, a quarterly basis, on a year-to-year basis, we see more and more physicians choosing to come to Alberta communities to serve our patients. So, look, I think that's the most important thing to point out, because unfortunately it is creating fear among patients. I'm happy that to see the numbers continue to increase. We have actually, for the first time in the history of this province, we have 11,000 physicians. It's the highest number in the history of this province. So look, I'm very happy to be in this role and continuing to serve Albertans through the pandemic. And as well to do all the other enormous projects that are required to continue to improve the health system for our patients.
All right, do we have any more questions from the floor? Go ahead.
Hi, Stephanie Babbage of the Calgary Herald and Sun. With new daily case numbers rising over 200 for the last few days, and specifically the increases seen in Edmonton and Calgary, how is Alberta Health responding, and are there increased restrictions being considered, anything like that?
Well, what we're going to do is, it was starting, because I was briefed on this by Dr. Henshaw yesterday, so what we're going to do is starting to communicate to folks in Edmonton Zone on increased voluntary measures we're going to be recommending for Edmontonians and for others in Edmonton Zone. I think there has to be a better communication strategy for people, especially where we do see a lot of our numbers increasing, folks who are younger in age, for them to continue to remember. They have to take these measures, listen to the public health guidance that's being recommended by our public health officials, including Dr. Henshaw and all of the other public health officials in the ministry and AHS, because those measures are going to protect Albertans, and it's going to protect their loved ones, it's going to protect their communities. So it's going to be really important for us to be able to continue to communicate that throughout the pandemic, as people are getting more frustrated with these measures, because it's now been months and months of living with COVID in the province. But we are going to have increased voluntary measures that we're going to be recommending for folks in Edmonton Zone. Any follow-up question?
No, thank you.
Okay, thank you.
All right, we'll go to the phones now. Operator, can you please put through the first caller?
Our first question comes from Audrey Nouveau of Radio Canada. Your line is open.
Hi, my question is for Minister Shandro. I'm sorry if this question has been asked before. The line cut off sometimes for me. But concerning the numbers of doctors in the province, when we look at the number, we see a net increase. But how much of an impact do you think that COVID had on retaining doctors in the province? It happened not very long, like in the month after you terminated the agreement with AMA. So how much of an impact do you think that played in retaining them in the province in the last year?
So a few things. So again, the previous framework that we had with physicians and the AMA was a complicated framework that includes legislation. The legislation says how physicians are paid. And we did have many different agreements with the Alberta Medical Association, an information sharing agreement. There was an agreement where we give them taxpayer money to be able to provide benefits to physicians. And then there was an agreement that was named the Master Agreement with the Redford government. Now, look, that didn't say how physicians were to be paid. What it did was take away the authority of the ministry and government in being able to set a budget. We do have a new framework that we announced in February. It does not include that master agreement, but we are setting a budget for physicians to be paid in this province at the highest level in the history of this province, and the highest level in the country on a per capita basis. We've also provided the stability and predictability for physicians on any changes to their compensation by having an advisory committee where the AMA gets 2 spots on that advisory committee, and then they can work on that committee when there's questions that either the AMA has or we have, that they can work towards giving us recommendations before there are changes done. So this framework that was announced in February provides that predictability and that stability. I would also say when it comes to retention and recruitment, yeah, we see an issue, a chronic issue in our rural communities throughout Canada, and that includes Alberta, and that's why we announced our action plan in April, working with our rural colleagues, which actually increased the amount that our rural physicians are paid. That action plan costs about $81 million, and this is for the 700 physicians who serve in those rural communities. So in rural Alberta, that is an issue, and we want to be able to continue to retain those physicians and recruit more physicians, including buying spots in our medical schools so we can have service agreements where those folks can then serve in those rural communities. But this report, this quarterly report, as well as every other quarterly report from the College of Physicians and Surgeons, shows that our communities continue to see increases of physicians working in those communities, and that's quite frankly because physicians throughout the world, as well as those who are trained here in Alberta, continue to see Alberta as a fantastic place to live, a fantastic place for them to practice medicine. Follow-up question?
Yes, but don't you think that COVID maybe had an impact on physicians who would have thought to leave either for another province or altogether the profession and didn't want to because they felt the duty to stay in such a pandemic?
Look, again, we see increases of physicians in the last quarter. So this isn't, as well as on a year-to-year basis, we see more people coming to the province. In Calgary alone, because I remember that number off the top of my head, we saw 130 new physicians come to Calgary. We saw in Edmonton 70 new physicians in the last quarter come to Edmonton. We saw more and more physicians coming, those who are both trained in Alberta and wanted to stay here to be physicians, as well as those who were trained abroad and wanted to come to Alberta to open practice here. And that's what those numbers are saying. The numbers are showing that the disinformation of the NDP is completely false, that physicians see this is, quite frankly, one of the most generous, if it's not the generous place to be paid as a physician in the country, but it's also one of the most fantastic places to raise a family and to serve patients. And that's what we're seeing. That's what the numbers show.
Thank you, Audrey. Operator, can you please put through the next caller?
Our next question comes from Kevin Nimick of CTV. Your line is open.
Hey, Kevin.
Hi, Minister. How are you?
Good.
I do have two questions for you, so an initial and a follow-up.
Sure.
Pharmacists we've spoken to, both in Calgary and Edmonton, are already filling up with appointment times for flu shots. Is the province confident people will be able to get shots in a timely manner, and do we have a sufficient supply of immunization?
Well, we have procured, we've ordered much more vaccine for the flu than we have in previous years because we know more people are going to be interested in receiving that vaccine because of the pandemic. So we have ordered more. We're confident at this time that we are going to have enough vaccine. We're grateful in not even just being able to provide vaccines to Albertans in our public health clinics, but also having pharmacists as partners throughout the province is fantastic. They give us additional capacity. We are thankful to the pharmacists and being able to work with us and give us that additional capacity. I haven't heard any concerns. I'm happy to look into that if you've heard anecdotally that there are some pharmacists who have the concerns, but to make sure that we not only have enough vaccine, but that we have enough capacity for people to get them in a timely way. I'm happy to look into that. Thanks, Kevin. What was your follow-up, Kevin?
Yeah, I have a second question for Minister Schweitzer. I'm looking at a Business Development Bank of Canada report, a survey of 500 Alberta and Saskatchewan business owners. It finds 75% of businesses in the region have been negatively impacted by the pandemic. What specifically are you looking at to help with business confidence moving forward, especially as we potentially head towards higher case numbers in the fall as more people tend to go inside?
Well, I think this just goes back to the Premier's foresight in launching the Alberta Recovery Plan this summer. I mean, in addition to people wanting to be safe in their communities and that that health need in their lives, and Albertans have done an excellent job in that front. And really, hats off to all of our medical professionals, Alberta Health Services, our health minister, all of their tireless efforts to keep all of us healthy and safe. But as we start moving forward and out of this pandemic, the biggest thing that we can do is to continue those efforts to keep our businesses open by making sure we keep the case numbers low. And then on top of that, we're starting to roll out our recovery plan. You would have seen many announcements over this last month. We announced just yesterday our initiatives around hydrogen and the opportunities that are there, issues around plastic recycling, other areas that we have here where Alberta has strategic advantages and can lead. We're also going to make sure we roll out our sector strategies completely when it comes to agriculture, forestry, small businesses, technology companies, intellectual property. You've seen us roll out different areas there where Alberta has to make sure we're at the forefront. And we have the ability in some of these areas where we may be a bit behind from a policy perspective to actually get to the forefront in a very short period of time because you have a government that's willing to move with the speed of business. So to those small businesses out there that are working hard, just trying to pay their bills, we commend you for all of your hard work. We have a government here that's working with you to break down any barriers that you have to make sure you can continue to do what you do so well. And we're going to continue to be there as we come out of this pandemic together to make sure that we have the right policy framework in place so that they can thrive going forward.
Thanks, Kevin. I think that concludes our media portion of this announcement. Thank you, everyone.
Thank you very much, Nick. Oh, you gotta go this way.
That's going to be leading the way here.